We will be discussing about axillary nerve. So axillary nerve, it is also called the circumflex nerve. So it is a branch of posterior brachial plexus. So the root value of axillary nerve is C5, C6. So it passes through three structures. So it passes through the axilla. It passes through a space known as the quadrangular space, and next it passes through the surgical neck of humerus on the posterior aspect. So first in the axilla, it is related anteriorly to the third part of axillary artery. And posteriorly subscapularis muscle. And medially plus radial nerve. So the axillary nerve, it passes through the axilla but it doesn't supply any structures in the axilla. So from the axilla, it passes through the lower border of the subscapularis muscle into a space known as quadrangular space. Now let's see what is quadrangular space. So this is the scapula. This is the spine, the scapula. This is the acromion. This is the humerus. The set of muscle here. There's a muscle here which is known as teres minor. And there's a muscle here which is teres major. And there's a long head of triceps, long head of triceps. We get a space here which is known as quadrangular space. So through this space, two structures passes. One is the axillary nerve and the other is a blood vessel known as the posterior circumflex humeral artery. Posterior circumflex humeral artery. So the axillary nerve, after passing through the axilla, it passes through the quadrangular space. The space is bounded above by the teres minor, below by the teres major, on the medial side by the long head of triceps, on the lateral side by the humerus. So it passes into the quadrangular space along with the posterior circumflex humeral artery, and it passes into the surgical head of humerus on the posterior aspect. Then the main trunk of the axillary nerve gives a branch to the shoulder joint also. So this is a branch to the shoulder joint. Then axillary nerve, it divides into two branches. One is the anterior branch and another one is the posterior branch. So the posterior branch, it supplies the muscle, that is the teres minor, and ends in a pseudoganglion. Then the posterior branch also supplies posterior aspect of deltoid muscle. So deltoid muscle, posterior aspect of deltoid muscle, and it also gives out a sensory branch, which is the upper lateral cutaneous nerve of arm. So this is a sensory branch which supplies the skin over lower part of deltoid near its attachment. This is the supply of the posterior division of the axillary nerve. So the posterior division of the axillary nerve, that is the posterior branch, supplies the teres minor muscle and ends in the pseudoganglion. It also supplies posterior fibers of the deltoid, and it is ending as a sensory branch known as the upper lateral cutaneous nerve of the arm, which supplies the skin over the lower part of deltoid. Now the anterior branch, it passes anteriorly and supplies the major part of deltoid. So the anterior branch supplies deltoid, mostly the anterior fibers. Now what happens when the axillary nerve is injured? So this can get injured in two cases. One is the anterior dislocation of shoulder. Another case is fracture surgical head of humerus. And how do you test the nerve? How do you get to know that the axillary nerve is injured? So we know that the axillary nerve, it supplies a muscle which is a major abductor of the shoulder joint, that is the deltoid muscle. So it causes abduction at the shoulder joint, and another muscle which is the teres minor, which causes lateral rotation at the shoulder joint. And within that, it has got an upper lateral cutaneous nerve of the arm. It supplies the skin over the lower part of deltoid. So this is an abductor of the shoulder joint. So when the axillary nerve is injured, the nerve supplies to these muscles are loose. So the patient will not be able to abduct his shoulder. Lateral rotation is also not possible, and there is anaesthesia over the skin on the lower part of deltoid, which is known as regimenta anaesthesia. So one thing about the axillary nerve is that the axillary nerve, it supplies the shoulder joint, and it is supplying the muscle which is lying over the shoulder joint, which is the deltoid. And the skin near that joint. So it is a nerve which supplies the joint, the muscle which is over that joint, and the skin near the joint. So it is a nerve which obeys the Hilton's law. That's all about axillary nerve. To see more videos from our channel, please subscribe our channel. Thank you.